Hello and welcome to Pregnancy Info. Today we are going to discuss about the differences between PCOD and PCOS. Women of reproductive age from the adolescent stage onwards start with hormonal fluctuations. These fluctuations might lead to various endocrine and metabolic disorders. PCOD and PCOS, commonly known as metabolic disorders, concerned with the ovaries. The ovary is a reproductive organ that changes its form, appearance, and shape according to its hormonal environment. Let's learn the differences between these two endocrine disorders. Number 1. What is PCOD? PCOD, called polycystic ovarian disease, is a condition where the ovaries contain multiple immature eggs which later get converted into fluid-filled spaces called cysts. This condition is mainly hereditary and is passed from mothers through generations. The main underlying cause for this condition is a hormonal imbalance, especially an increase in the endocrine male hormone. It is a highly common condition and more prevalent in women of age group 12 to 45 years. The clinical features of PCOD are irregular ovulation, obesity, alopecia or male pattern baldness, irregular periods, difficulty in concentration. Now, what is PCOS? PCOS, called polycystic ovarian syndrome, is a condition more severe than PCOD. In this, the ovaries produce more male hormones, which leads to a higher number of non-functional follicles or cysts in the ovaries per cycle. The higher number of these cysts lead to an anovulatory cycles where a mature egg is not available for fertilization. This leads to infertility. What are the clinical features of PCOS? Enlarged and bulky ovaries with more than 10 ml volume, leading to overproducing of androgens, more than 12 follicles, each measuring 2 to 9 millimeters in diameter, organized around the lining of the ovary like a necklace, irregular or missing periods, heavy periods, acne, hair loss, android type of obesity, mean apple-shaped, infertility, insulin resistance, gestational diabetes, excess body weight, hirsutism, mean excess hair growth on various parts of the body. PCOS, if left untreated, leads to other lifestyle disorders like obesity, type 2 diabetes, and increase in blood cholesterol level. The physical changes seen in PCOS can severely affect the confidence or self-esteem of women and their body image that contributes to psychological disturbance like anxiety and depression. Another factor that also affects their mental health is the societal pressure to have children as they struggle hard to conceive. What are the causes of PCOD and PCOS? The exact reason for these disorders are not known, but a few theories suggest a myriad of abnormalities. The abnormalities could be low levels of hormones like progesterone due to infrequent ovulation, overproduction of androgens, which could trigger insulin resistance, and abnormal androgen levels that signals the overproduction of follicles. Now, we are doing a comparison between PCOS and PCOD. Number 1. Occurrence. PCOS is rare and lesser in patients, common in women worldwide. It's about PCOD. A definition: PCOS, endocrine disorders of ovaries with mature follicles. In PCOD, metabolic disorder due to hormonal imbalance. Presence of cysts. In PCOS, minimum number of cysts. PCOD, more than 10 cysts in each ovary. Causes. In PCOS, genetic, lifestyle, eating habits, mental health, and in PCOD, genetics, insulin resistance, inflammation, weight. Severity. PCOS cannot be reversed and PCOD can be reversed with medication. Treatment. In PCOS, diet control, exercise, lifestyle changes, and medications. In PCOD, diet, exercise, medication, and surgery. Complications. PCOS hard to get pregnant, risks of diabetes, high blood pressure, obesity, endometrial cancer. In PCOD, easy to get pregnant with medical aids. Now we are going to give you some tips about PCOS and PCOD. Weight loss with an increase in fat-free mass is the mainstay for improvement of both PCOD and PCOS, according to the International Evidence-Based Guideline for the Assessment and Management of PCOS. And insulin resistance is mostly associated with PCOS. Women should cut down on simple sugar and rather include more whole foods rich in complex carbohydrates in their diet. Weight loss will not just increase the chances of ovulation and subsequent pregnancy but also minimize the risk of miscarriage. Regular physical activity and a balanced diet can help in long-term weight management. An appropriate and effective dietary recommendation is still a debate for PCOS. According to few studies, dietary intake was assessed in women with PCOS and it was found that these women consumed high glycemic index carbohydrates such as white bread and fried potatoes. Of all the popular diets, the Mediterranean diet promotes low GI carbohydrate, high fiber, unsaturated fats, vegetables, and fruits, and is found to be effective in the management of various lifestyle disorders like insulin resistance, diabetes, hypercholesterolemia, etc. Lean women with PCOS should aim to maintain the body weight with consumption of a balanced diet as mentioned in the dietary recommendation. Excess hair growth due to PCOS/PCOD can be managed by various methods like laser hair removal treatment and the use of oral contraceptives to suppress androgen production. Acne that is mild to moderate can be treated with topical applications like benzoyl peroxide or clindamycin creams. For mental health in women with PCOS, physical exercise is done. Group exercise has shown a better outcome of quality of life. So now you have cleared the differences between PCOS and PCOD. Must share this information with other females that they can understand the differences between the PCOS and PCOD and they should be aware of their own health. Thank you, take care and bye-bye.